Diabetes is a chronic condition where the body has problems processing sugar. Typically, a hormone called insulin helps convert sugar into energy. However, when the pancreas is unable to produce or use enough insulin, blood sugar spikes. This can lead to serious health complications. There are two types of diabetes: type 1, which is usually diagnosed early in life, and type 2, which is typically diagnosed later. Over 90% of diabetics have type 2 diabetes, with 1 or 2 out of every 10 Americans having type 2 diabetes. The rate among veterans is even higher, with 2 or 3 out of every 10 having the condition. It is worth noting that men are more likely than women to develop diabetes, and among the population at large, African Americans, Latinos, American Indians, and Alaska Natives have higher rates of diabetes. Diabetes is relatively common, but left untreated, it can cause nerve damage and eye, heart, and kidney disease. Over years, this can lead to blindness, foot amputation, heart attack, stroke, and kidney dialysis or transplant. Primary risk factors for getting type 2 diabetes are being 45 years or older and being overweight or obese. Being physically active less than 3 times a week is a risk factor too. Having a parent, brother, or sister with type 2 diabetes also increases your risk. Some early symptoms of type 2 diabetes are feeling hungry, tired, or thirsty, dry mouth, the need to urinate often, or frequent yeast infections, losing weight without trying, or vision problems. You must work with a healthcare provider to diagnose and manage diabetes. One common measure to see if you have diabetes is a fasting blood sugar test. This measures your blood sugar levels after not having eaten since the night before. You must fast to assure the results are accurate. A fasting blood sugar level of 99 milligrams per deciliter or lower is normal. Prediabetes is where your fasting blood sugar level is 100 to 125 milligrams per deciliter. You have type 2 diabetes when your fasting blood sugar level is 126 milligrams per deciliter or higher. The A1C test measures average blood sugar levels for the past 2 to 3 months. An A1C score below 5.7% is normal. Prediabetes is a score from 5.7% to 6.4%. Diabetes is diagnosed when your score is 6.5% or more on 2 separate tests. Scores above 7% increase the risk of serious health conditions. There are many medications to treat type 2 diabetes. Exercise, losing weight, and eating better is also recommended. Some patients may also need insulin or other injections. Your provider may use the A1C test to track how well you're managing blood sugar levels. An A1C level of less than 7% is a common treatment target. African American patients with type 2 diabetes may have higher A1C scores. This should be considered in setting treatment target scores. People can do helpful things to best manage their type 2 diabetes. Work as a team with your health provider. Take your medications. Test your blood sugar levels and keep a record. Develop and stick to a healthy eating and exercise plan. Recognize the signs of high or low blood sugar and what to do about it. Check your feet, skin, and eyes to catch problems early. Thank you for watching. For more information on diabetes, please visit the links below.